Good evening, everyone. We're going to give you a minute or so to let some additional attendees get on. I know the phone lines get to be a little bit busy with everyone at home these days, so we'll give another minute or so to let more join. So please stay tuned. Well, good evening, everyone. We'll go ahead and get started here. I know there's several that are still logging on, but we want to be conscious of everyone's time tonight. So thank you for sharing your valuable time with us this evening during this challenging situation we all face. We hope your loved ones and the team members are safe as we all work through the COVID-19 pandemic. My name is Wendy Zukowski, and on behalf of Henry Schein Practice Services, it is our privilege to host you for this webinar. As we plan to be respectful of your time, our webinar will plan to end by 9:45 Eastern, unless the questions are so immense that we need to go a little bit longer, but our goal is to end by 9:45 to be respectful of your time. If we do not get your questions by that time, we will follow up with you individually. Please note the section on your screen that allows you to submit questions. This will be more conversational and a little less presentation. We want to make sure that we are able to answer your questions. So please do not hesitate to start sending your questions in now and throughout the discussion, and we will do our best to get them taken care of during the Q&A part of our session. So if you want to advance the slide to the disclaimer. As with many situations, there are disclaimers involved. So there is a disclaimer on the screen. I won't read the entire disclaimer, but please be advised that the information shared during this presentation is intended to be informative in nature and is not intended to be a substitute for legal advice. And just to summarize, listeners are expected to make their own business decisions. Nothing contained herein should be treated as legal, business, international, regulatory, insurance, tax, or financial advice. So as you might expect, we're gonna get some really informative information tonight. Look forward to it. So with that, we are joined by Ali Aramchian of HR for Health. Ali is co-founder and chief executive officer of HR for Health, which is a software as a service platform that provides web-based human resources solutions and advice for healthcare practice owners and managers. Ali is also a founding attorney of the Dental and Medical Council, PC, law firm, and one of the nation's leading legal authorities on topics relevant to doctors. Since its creation, the Dental and Medical Council, PC law firm has been regarded as one of the preeminent law firms devoted exclusively to healthcare professionals. Clients seek Ali's advice on practice acquisitions and sales, creation of corporations and partnerships, associate contracts, estate planning, employment law matters, office leasing, and state board defense. It is important to note that Henry Schein has instituted a COVID-19 resource center where these webinars, such as this one, will be posted along with other valuable content. You can go to henryschein.com/coronavirus where you can access the resource center. It will be posted on that site following, probably tomorrow following this webinar. We will be updating this regularly with new content and have another set of webinars scheduled to start as soon as Monday. We are here to help, of course, however we can as we work through the COVID-19 pandemic and its effect on all of us. So with that, I'd like to introduce Mr. Ali Aramchian.
Thank you, Winnie. That was a great introduction. Thank you so much. Well, hello, everyone. I know this is a crazy time for everyone around the country. You know, on a personal level, it's crazy. Obviously, from a business perspective, it's crazy, especially with kind of how everything has kind of very rapidly occurred. And every day and every hour, there seems to be new revelations and new laws and new guidance that is being issued. So it is definitely one of those moments in time where I think a lot of us will never forget. Where are we now? Well, as many of you know, the ADA has recommended that dentists nationwide postpone all elective procedures. They're kind of leaving it up to each practitioner to decide what is considered more of an emergency nature versus elective. But that recommendation does come from the ADA. Many states have followed suit as well and made similar types of recommendations either right before the ADA or since then. We just got word that Washington State might be asking its dentists to close down for 2 months, which I think is the longest that any state has asked any dental office from shutting down. So these are trying times, and the goal of today is really to get into some of the weeds of what this means for your office, what this means for your team, what it means for you, and how you can kind of resolve it and how you can manage it and what you can do sort of next to ensure that when things get back to normal, that you're set up in a way that allows you to get back to normal as fast as possible, whatever the new normal might be. So let's talk about unemployment, because that is the top question that I'm getting right now, which is, well, can my team get unemployment insurance in my state if I don't fire them? And the answer to that is yes. We are not recommending that anybody fire their team members right now. In almost every state, you are able to have your employees attain unemployment insurance even though you have not fired them. So the simple reduction of hours, reduction of work, the closure of the office is sufficient for them to apply and attain unemployment insurance. So that's a very important, that's a very important aspect of the next few weeks and months, because your team will rely on this unemployment, and they will absolutely need it if you're not able to, have them work remotely or if your office is truly closed. A related question that we get is, what if I have PTO and sick time? What happens then? Can I force my employees to take it, or must they take it? And the reality is that if you have any paid time off, any sick time or vacation, your employees can use those themselves, or they can request that you pay them out for it. In most states, paid time off and vacation is considered earned wages, so they've already earned it. And so if they request that you pay them out, which would make a lot of sense because it's their full wages, then you are obligated to pay them out for that. Can you require them to take it? This varies state by state, depending on your state and then depending on what's in your employment manual. You may be required to, or you may be able to require them to use their paid time off or their sick leave or vacation before going on unemployment. My recommendation in this regard is that you just be a little bit more flexible than maybe normal or maybe what your policies say. This is a very difficult time for a lot of your team, and so if they want to save their sick leave for the rest of the year, or they don't want to use it now, they just want to go on unemployment, I think it's prudent to be flexible with them in that regard. Another kind of related question that I get is, can I, as the owner of the practice, go on unemployment myself, or can my spouse go on unemployment if she or he works in the practice? And the reality is that yes, unemployment is available to business owners as well, and to their spouses. My only sort of recommendation there is that you be very careful when filling out the application for unemployment. The unemployment agencies throughout the country look very skeptically at owners who file for unemployment. And so as a result, the last thing we want is for you to get audited for unemployment insurance fraud or something related to that. So if you're answering those questions, be very, very specific, be very accurate. Don't go into any gray areas. Try to answer those questions as truthfully as possible, as it could come back and haunt you a little bit later. And so, as we go into the sort of the next kind of area, what do I do if my team wants to go into negative in the PTO section? In other words, what if can I advance them more PTO or more vacation time? The answer there is you definitely can. There's nothing wrong with you going in the negative, which basically means you're lending them more PTO or sick or vacation time, and then hopefully when things get back to normal, they will earn it back and by working in your office. That's totally fine and not an issue at all. You just have to keep in mind that there is a possibility that employees will quit. There is a possibility that things, will not be normal, if you will, and the new normal may look a little bit different. And so you may end up not having your employees that employee that you lent those PTO, sick, or vacation time, so it may not be with you to earn it back. But again, are you able to do it? And the answer to that is absolutely yes. Another question that we get a lot is, what about my bank loans? I've got loans to the dental lenders because I opened my office not too many years ago, or I owe money because I bought my building, or maybe I bought a practice. So most banks right now are doing deferments, especially the dental lenders are trying to be as flexible as they can, which is great. What I would recommend is that you contact your lender and you kind of explain your situation if you're running into some cash flow issues as a result of the closure, and ask them for a deferment. Most are giving 6 to 9 month deferments, depending on the situation. You may have to prove that you are in need and that you don't have the ability to pay, but considering the fact that your office is closed and you're not seeing patients or whatnot, that may not be as difficult as in other situations. The other thing is you want to be careful that your interest on your loan is not being negatively amortized. This is very, very important. You don't want to go into a deferment where the interest that is being quote unquote deferred is being added onto your principal. None of the dental banks that we've spoken to in the last 3 days have told us they're doing this. However, some of the non-dental banks are, which is another great reason to go with a dental lender, when you're trying to start a practice or buy something. But what I would say is just play it safe. Make sure you ask them. Make sure it's in writing, so it's absolutely clear what's happening with that interest, so that your principal balance doesn't go up, and which will cause you to, it will take longer for you to pay it back. With regard to rent and landlords, they are going to be less flexible. And the reality is a lot of landlords fit into 2 categories. Either they're kind of small landlords and they have their own mortgages and their own loan obligations and whatnot, and they can't afford to give you, deferments. Or they fit in the second bucket, which is they're large hedge funds or private equity groups who own the building, or they're kind of mutual funds or whatnot, and so they have less flexibility because, quite honestly, they just don't care, and they want their rent. So does it hurt to talk to your landlord? Absolutely not. I think if your office is closed, you should have that conversation, but don't be surprised if they don't defer anything or if they're not flexible. I will tell you, most of your leases will have very, very strong language when it comes to violations and breaches of your rental obligations. And so you may lose your lease, you may lose your office, they may be able to kick you out. All of those things are very real things that could happen, despite the fact that we're in a national emergency situation. I would not count on getting relief from the federal government in any sort of way. So if there was one bill that I would make sure I paid when it came to your office, it would be your rent, because you can find some flexibility with the banks, but your landlord maybe not. So I would absolutely make sure you're covered there. And so just kind of keep that in mind as we kind of progress. For those of you that are in a real cash crunch, and this applies to a lot of dentists. I mean, this is this is not, for people who are new to practice. This is not for people who recently bought a practice or started. I mean, this applies to a lot of our dentists nationwide for a lot of reasons. One, it's because of the nature of our businesses. It's, they're very, it's all cash flow heavy. There's a lot of debt associated with running a practice, and so there may not be a lot of cash flow that you have kind of sitting there waiting for a 1 month, 2 month, period of time where you have to pay expenses with no revenue. Well, the SBA has put out some really great programs which you can apply for, and they will loan you about $2 million. They don't give it to you all at once, but they do give it to you, as you prove that you are in need, and they can give you up to $2 million with very low interest rates and very favorable terms to get you past this kind of moment in time. They actually don't they don't want anybody to help you do this. They want you to go directly through them. So if anybody approaches you and says, pay me a fee and I'll help you navigate through this, just know that that's fraudulent. The SBA actually has said we want to work directly with the borrowers, and so they've created a really great website. And you can go on there, you can call them, you can submit things online. Obviously as time goes, it'll become more difficult to get a hold of somebody there, because a lot of them are home too. but I would tell you to file immediately if you are in a cash crunch position and you're afraid of your funding kind of scenarios, because they are there and they are ready to help. And so it's definitely something to keep in mind. The other thing is you have to be in a disaster area or in a state that has declared a natural emergency. I don't believe every state has, but I believe most of the states out there have declared a national emergency. So most of you should be okay. Some counties in states that have not declared a national or a state emergency, I should say, have also declared a county-wide emergency, if you will, but there has to be some sort of some sort of state or local designation of an emergency for you to be able to get this SBA assistance. So if you go on their website, there's a way for you to put in the county that you're in or whatnot, and check to see if you qualify. Now, let's talk about the next sort of topic, which a lot of people are asking us, which is what happens if one of my employees has the virus or has been infected or is around someone who's got the virus. So our recommendation with that is very simply that employee should not be coming to work at all for at least the 2-week timetable where that has been recommended by the CDC to ensure that either they overcome their symptoms or that they maybe hopefully don't have the symptoms. This is vital. I mean, on very many different levels, and so you want to make sure that you are not kind of going around this, because this is how the virus is spreading, is when people who are infected, who are maybe taking a little bit more lightly, are coming to work or exposing other people. If you have anybody who's working for you who's around the age of 65 or above, or if they are pregnant, we highly recommend that you not have them come to the office to help you with emergency patients or otherwise. They are, the employees that are close to 65 or older are definitely in jeopardy. Their health is absolutely an issue, as many of you know, and so that is an absolute no-go. There's no scientific research that I know of that says that someone who's pregnant is either more susceptible to the virus or that the fetus would get injured, hurt some way. But my view on this is that if someone's pregnant, the last thing we want is for any complications with the baby to be blamed on the practice or on the doctor or on anybody related to the business. And so I just would not take that chance and just have that person stay home and just look for someone else to help you with with your emergency cases, assuming you are closed. The reason I'm saying assuming you are closed is because some have avoided and ignored the rules by the ADA and their states and the county and the federal government and have kept their doors open. And what we are seeing now is that counties are policing this and showing up and forcing you to close or fining you or whatnot. We even have one situation on social media where patients and others kind of have put up a lot of negativity towards the office that was open and seeing patients as if it was just a normal day. And so I don't think anybody wants to be on that side of social media or on that side of the PR side. So we are recommending that unless you absolutely have to go in, that you follow the ADA's guidelines, you follow the CDC's guidelines of no more than 10 people in a room, 6 feet apart, no congregation, and all those things that most of you have read and know about. The next question is, what happens if a patient gets the virus? And there's a couple of things I want to mention here. If a patient gets the virus, that is definitely a scare. Whether they can actually pinpoint it to your office, I'm not so sure. It's almost impossible for anybody to know where they got the virus from. But does that mean that it's unheard of? No, it's definitely not unheard of, and we can imagine people doing that. There has been talk of waivers. We are working on putting a waiver together for you if you want employees or patients to sign a waiver when they come into your office for emergencies or otherwise. Later today, I'll give you some ways to get a hold of us, and when that waiver is ready, we can shoot it out to you as well. But will it have legal effect? It's really unknown. I mean, I'll be honest. We don't know whether a waiver like that will really ever hold up in some sort of court of law, because there's never been a situation like this before. But does it hurt? It probably doesn't hurt to have. Now, tied to this, what do you do with insurance? And so what am I referring to here? Well, a lot of you have probably contacted your insurance companies that you work for, or work with, I should say, and asked them if they will cover your overhead, your rent, and all these other costs when you're shut down. And unfortunately, what I have to share with you is that a lot of this business interruption insurance that we're talking about or even overhead insurance, to be more precise, is tied to the disability insurance claims or insurance policies of the doctor. So what that basically means is that the doctor would have to be disabled for it to kick in. So if the doctor gets the virus, then they might be able to apply for it, and on a case-by-case basis, insurance companies will have to evaluate whether that fits their disability, protocols. We haven't seen any insurance policies that include a virus epidemic as part of what's included. So the likelihood is that maybe it won't be, accepted, but it's worth a try. But it only applies if the doctor is the one who contracts the virus and is diagnosed and whatnot. And of course, most of these policies I have like 90-day periods of time, and there's a lot of other things that may limit your ability to get it from the insurance company, but that's one way of getting it. If an employee gets the virus while working for you, sort of on the job, if you will, they can file for relief under workers' comp, and their medical bills and whatnot may be paid through workers' comp. If a patient gets the virus while in your office, then they will have to file a claim under your general liability policies. Again, very hard to prove that they got the virus from you directly or at your office, but it could definitely happen. So now let's talk about HR 6201, which is, as many of you know, the new law that the president signed yesterday. It is anything but clear on many topics of great importance, but let's go through them. There are three major portions that apply to dentists. There's the OSHA portion, which basically states that OSHA will be putting out some new regs regarding what you need to do as a dental practice to deal with this virus, and so they've been given 30 days to do that. It's probably unlikely that they will be able to do it in the next 30 days, but maybe they are. So that's coming down the pipe, and every dental practice in the country will have to kind of abide by these new rules. There are, some very specific things regarding, the current OSHA laws regarding your obligations to deal with any known threats in the practice. Here, one of these threats is the virus. It's a known threat now. So I raise that because you already have an obligation under OSHA to keep the office free and clear of a known threat. So what that means is that if someone in your office gets infected, or if a patient comes in with a temperature and they're infected, or you get notified a few days later that a patient had it or an employee has it or whatnot, you must immediately shut down the office, notify every potential patient and employee who has walked through the doors and may have been exposed. I'm sure many of you saw the other day, I think it was yesterday, that the virus can live in the air for 3 days. And I think that came down from the CDC. So you have to just be aware of these rules. And so if your office is already shut down, and I would just sort of sit tight until the new OSHA regs come through. But if your office is open, or if a vendor or a patient or anybody is diagnosed with it, you have to take these steps. The Emergency Family and Medical Leave Act is the next item in 6201 that is, I'm sure, very of importance to everybody. So what is important to know is that the rules right now are slightly in flux when it comes to 6201, and I'll tell you why. Because with the medical, with the FMLA, Emergency FMLA Act and the Emergency Paid Sick Act, there's language in HR 6201 that appears on its face to exclude dentists from these regulations. Okay, so what that basically means is that you may not have to, under the Family and Medical Leave Act, provide 12 weeks of leave for your team if they fit in one of the 6 categories. In other words, if they are sick themselves, around somebody who's been sick, taking care of a kid who's sick, or any of the other rules, you may not be bound by it. The reason the language, and we believe that dental offices will be excluded, but we're waiting for further clarification on the rule, because with the way the language reads, it could be limited to just dentists themselves and not their teams. So there is a very strict reading of it that implies that it could be just for the dentists and not for their teams. The reason I don't believe this is necessarily going to be the case is because a lot of the talk in Congress amongst the Republicans and Democrats has been about ensuring that the healthcare system is still operational and treating patients. And so if they only allow dentists to be excluded and all team members can take family and medical leave or paid sick leave, then there's not going to be hospitals that operate. There may not be dental practices that can operate without their teams. So it sounds counterintuitive, but a lot has happened since yesterday where there's been a lot of information coming and going from lobbyists and different folks in Congress and at the state levels that has kind of put a different spin on this. So for right now, what we're advising is that you sit tight and let your employees file for unemployment. If this turns out to not exclude dentists and their dental teams, then at that point, you can offer the sick leave or whatnot and pay them out for it or allow them to get compensated for it. If it does fall where we believe, it will fall, and where, a lot of, other attorneys around the country, not just healthcare, but other attorneys around the country believe this will fall, then you may not have to pay out the employees for either one of those. That being said, if you want to be generous and whatnot, and you want to take care of your team and you can afford to do so, then there's nothing wrong with paying them their 2 weeks of paid sick leave that they may be entitled to, or paying the 10 weeks of Family and Medical Leave Act that they may be entitled to after the first 2 weeks, which are unpaid. So there's a little bit of there's a little bit of wiggle room there for you. If you feel confused, believe me, it's because it's very confusing and the language is not as precise as I think anybody really was hoping for. But again, we believe that the intent was to exclude all healthcare practices as defined under the Family and Medical Leave Act, which includes dentistry. But the jury's still out, and we'll have to see what happens in the next few days. Now, we have a host of documents and things to provide to you, things that you can use almost immediately in your offices, and there's no string attached to any of these things. So if you text the word coronavirus, all one word, to that number 44222, you'll get an email from us. Actually, you'll get a text from us that will ask for your email, and then what you'll get is a link to all of our blog posts that we have posted on these topics over the last few days. So it'll give you even more details. You'll have an FAQ of very important questions that your team is asking and that you might be asking. You'll get an email template that you can use for your employees explaining their options for wage supplementation during this time. This has been a real hot thing that a lot of people have asked for because they don't know how to communicate this with their teams. You'll also get a sample office closure announcement that you can either mail or email or text to your patients. And then finally, you'll get a list of state unemployment websites that we've compiled for you so that you can take that information and access the unemployment websites. They can be confusing. Some states are better than others, but we've compiled it all. So you're getting a whole host of information because you're a Thrive customer, because you're a Henry Schein customer, and because we're partners with Henry Schein. And so you as an endorsed partner, there's no strings attached to any of this. So we hope you take advantage of it because that's our goal today. Now I think now it's time for questions. So if Winnie, I don't know if you have any that people have asked, or I'm happy to answer it.
Absolutely. Thank you, Ali. Great information, a lot of information covered. So I'm sure there will be continued questions even after today, but we'll start with a couple related to HR 6201, since that was the most recent topic that you covered. So regarding the OSHA side of things, how do we decide how far back we have to go in either patients or days to notify patients of a potential exposure?
Yeah, that's a great question, Winnie, and it's kind of like the $1 million question because it's so hard to know exactly when the person who was infected was in your office. I think with patients it's easy because if a patient is infected and they've come in and they tell you after the fact that they're infected, every patient that day, and maybe moving forward for 1 to 3 days was probably prudent to notify. For employees, you would have to have a really serious conversation with the employee to figure out when they think they were exposed, if they can even know, and kind of taking it from there. But it's going to be case by case, because you have to first figure that out before you can figure out how many days to go from there. So.
Perfect. Thank you. Definitely not an easy answer at all. So another one regarding family leave in HR 6201. If they have a part-time hygienist, typically working 1 to 2 days a week, and the kids are out of school and they claim a need for childcare, are they eligible for the 10 weeks paid family leave? And then does it matter if the spouse is actually also works from home already?
Yeah, no, great question. So it's unclear about whether the spouse is at all kind of relevant to the conversation, although it makes sense for them to be. But if an employee, assuming dentistry and dental team members are not excluded, assuming that the law says that if the way it's at least written now, the law says that if someone has to stay home due to the school closures, then they are entitled to the FMLA protection. That's sort of detailed. And so the answer to that is yes. The answer to that is yes. What that protection exactly is, for a part-time employee, we think for sick leave, it's a little bit more, I think, pronounced. For paid family leave, we think they're going to be entitled to the entire amount. So.
Okay, thank you. So I guess there's several things kind of tied together here, but one of these, if we advance PTO and they continue to work, but not long enough to pay it back, can we deduct the negative balance against the hours worked?
So if there's an agreement now, what I would do is I would have an agreement with each person that you're going to go in the negative with, kind of explaining how much you're going to go in the negative on for them, and then what the protocols are going to be for earning it back, if you will, and making sure you get it in writing from them that they approve that, so that there's no question about what's going to happen. And as long as they're working for you, that arrangement can be okay. Whether you can deduct it from the final paycheck is a whole other conversation. In some states like California, absolutely not. In other states, you might be able to if there's an agreement beforehand. But again, it's going to be a little bit of a case by case scenario there.
Thank you. So you mentioned paycheck. So I'll go to this next question. What do we do about the employee portion of medical benefits if our employees aren't receiving a paycheck for a few weeks?
Yeah, absolutely. So our recommendation is that you continue paying their portion, even though they're not working and not paying you. And then, once they come back, you deduct that from them, or have them sort of cut you a check. And obviously there's minimum wage rules and obligations that you have to abide by, but that's our recommendation. There's nothing that says you must do it, but we think that the law is going to come down in favor of the employees here and protect them, just like it protects pregnant employees. Like, you can't let the insurance of a pregnant employee expire. We think that it's the same thing is going to hold here, where you cannot let the insurance of someone in this kind of scenario where they cannot work, but it's temporarily shut down and they're still employed by you, but the office is closed, that they lose their insurance. So our recommendation is to make that portion of the payment. So.
Okay, thank you. So we have another couple of questions tied together. One, we'll start with regarding furlough. So if staff worked Monday and asked to stay home because the office will follow the state guidelines or recommendations to be closed, does that mean that the staff that staff at home is actually on furlough since Tuesday, or is this actually not furlough in this case?
Say that question again, Winnie.
If a staff worked on Monday, and then they asked to stay at home because the office will follow the state, guidelines or recommendations to be closed, does that mean that the staff at home is actually on furlough since Tuesday, or is it really not furlough in this case?
No, I mean it's you can call it what it is, but it's a mandatory shutdown starting Tuesday. So when they're filing for unemployment, there's not going to be most states don't have furlough as sort of a designation. Most have different kind of protocols. It says terminated or office closure or not enough lack of business or lack of demand or something of that nature. So I would just put the fact that there's lack of hours provided or no work provided for the unemployment purposes.
Perfect. So tied into that then, if a doctor, if they have to close the practice due to patient cancellations or, like we referenced, the government mandated regulations, do I still have to pay my employees?
So it depends. So if they're hourly employees, you do not. If they are salaried employees and they've worked that week that the closures are happening, then yes, you have to pay them for that week. The following week, however, you can put in parameters for them to work different hours or different days, and then prorate accordingly. So in some states this may not be allowed, but in most states you can set new schedules after the week where this kind of this closure happened. So if you are open, let's say a half a day on Monday or all day Monday, and then you close the rest of the week because of the guidelines, I would pay the salaried employees for the week. And then starting next week, if they're not working at all, just you don't have to pay them and you don't have to pay the hourly employees. If you're going to have your salaried employees work one day the following week, then I would start taking measures to make sure that that's dictated, that the work is changing to once a week, and then you prorate salaries accordingly.
Thank you. So tied into that then, regarding independent contractors, are they allowed to file for unemployment with us?
So yes and no. So if an independent contractor files for unemployment, they will likely get it because the unemployment agency will reclassify them as an employee and state that they were misclassified. If the state determines that they were misclassified, you will likely get audited. And at that point, the business gets audited for misclassifying that independent contractor and potentially other independent contractors. So our recommendation has been to independent contractors and employers, do not file for unemployment, because if you do, the likelihood of you getting audited is very, very high, down the road.
Thank you. That was definitely a big one. So we're coming up on our 45 minutes that we promised to be done. So we have one last question, and kind of the big one for the last, the big one at the end. Do you foresee a state mandate to close?
A state mandate to close?
Correct. So, state or federal?
Well, some states have, like I mentioned earlier, like Washington, we believe, I saw some things come through that they are mandating a 2-month close. I think they announced that today, although the source is, I'm not sure about the source, but other states have made recommendations. I think that if we don't get this under control, it could absolutely happen, because, especially if people are still seeing patients and kind of ignoring the recommendations, then yes. What I can tell you is that I don't know about that crystal ball, but I can almost assure you that when I do look in this crystal ball, that I think that 2 or 3 weeks that the CDA in California and the ADA and some other states have put out, I think it's going to be more than that. I think they're going to extend it because the cases are still growing and deaths are still happening. And I think most people are under that assumption. So.
Yeah, absolutely. It's really unfortunate for sure. Well, thank you, Ali. So we're at our 45 minutes. I want to make sure that everyone is able to leave on time. Remember, you can text coronavirus to 44222 to automatically receive more information and tools from HR for Health to help, by all means. And then you can certainly visit the henryschein.com/coronavirus resource center for additional information similar to this and extended information as well. So thank you for your time and interaction tonight. We hope it's been useful for you. We certainly want to be respectful of your time, so we will cut the webinar at this time. We will follow up individually if anyone did not get to your question. But thank you to Ali and the HR for Health team for taking the time to give us this great information tonight. Everyone have a wonderful night. Thank you.
Thank you, Winnie. Thank you.